My name is Matthew Gallegos, and today we'll be looking at cor pulmonale. Cor pulmonale, or also known as pulmonary heart disease, is an enlargement of the right side of the heart caused by a lung or pulmonary hypertension. It is also referred to as right-sided heart failure because of its association with the right ventricle. Cor pulmonale causes the right ventricle to enlarge and pump blood less effectively than it should. Thus, the ventricle is then pushed to its limit and ultimately fails. Usually it is a chronic condition unless it is caused by a pulmonary edema, in which case it is an acute cor pulmonale. Here you have an image showing you what right ventricular hypertrophy looks like. If you notice on the right image, the right ventricle musculature is enlarged, thus having a less capacity for blood to enter into the right ventricle. This is caused by the backflow or the high pressure it is receiving from the pulmonary arteries. So how does one acquire cor pulmonale? Well, it begins with a pulmonary hypertension, which then leads to this condition. According to the World Health Organization, 4 out of the 5 classifications for pulmonary hypertension can lead to cor pulmonale. First is connective tissue disorders, which include scleroderma, which is tissue hardening, and then heritable diseases. Second would be any kind of lung disease, such as obstructive sleep apnea and COPD. And then third would be with blood clots forming in the lungs leading to pulmonary hypertension, and then other diseases such as sarcoidosis, which is the enlargement of lymph nodes, or vasculitis, which is inflammation of the blood vessels due to tissue damage or chronic vascular disorders such as rheumatoid arthritis. Pulmonary vascular diseases and respiratory diseases such as emphysema and chronic bronchitis cause more than 50% of cor pulmonale cases in the United States. So how does cor pulmonale affect the body? Well, first you must understand that there is a hypertension, pulmonary hypertension, that leads to a decrease in right ventricle output, especially during exercise, that will eventually lead to a decrease in left ventricle filling. Thus, you see the cascade of conditions, decreasing the cardiac output. The patient will report shortness of breath, fatigue, abnormal and difficulty breathing, and this decrease in cardiac output will then lead to a decreased right coronary blood flow and ischemia to the right ventricle wall, causing inguinal chest pain, creating a vicious cycle for the patient. Chronic cor pulmonale can also lead to peripheral edema. So like I said, heart appears normal at rest, but with exercise, cardiac output drops and the ECG will show right ventricle hypertrophy. Also, be sure to check with your patients and educate them on how to assess the peripheral edema, especially in the lower extremities and the ankles. The prevalence of chronic cor pulmonale in the United States is difficult to determine because of its vast amount of primary causes. But according to the Goodman and Fuller text, it accounts for about 5 to 10 of adult heart disease in the United States. Prognosis is usually poor for this disease because of the chronic conditions that it is secondary to are usually irreversible. And lastly, an acute large pulmonary embolism is the most common cause of acute life-threatening cor pulmonale, attributing to about 25,000 deaths from the right heart failure every year. Now, when talking about interventions, the primary goal is to decrease the workload of the right ventricle. That might be through oxygen administration, salts, fluid retention, or treating underlying pulmonary conditions. Medication also depends on the cause of the cor pulmonale. So here you can see how you would treat the different conditions primary to this condition. Also, prescription medications can decrease the blood pressure and help encourage oxygen flow back into the lungs. Diuretics are usually used to reduce retention and to keep the patient's blood sodium levels down. Severe or advanced cases of cor pulmonale require more aggressive treatment, such as heart or lung transplant. With a review of the literature, I found several articles that pertain to therapy with cor pulmonale. So first, therapy was usually focused on the underlying pulmonary disease or improving oxygenation of the patients. And since most patients with cor pulmonale had developed it from COPD, COPD precautions were also considered. And then a study by Catoni et al. Suggested that a prone positioning reduces dead space ventilation, resolves vasoconstriction in the lungs, and decreases right ventricle afterload. Now, for the purposes of PTH-526, we will look at the relevance of the top 20 questions in class. So since cor pulmonale begins as a pulmonary condition that manifests into a cardiac condition, the whole cardiopulmonary system becomes compromised. So you will have a decrease in cardiac output, which leads to ischemia of the right ventricle wall, which causing inguinal chest pain. And then depending on the pulmonary conditions, there will be other systemic cascades as well. And then auscultations you may hear will be wheezing, crackles, and a systolic ejection murmur over the pulmonary artery. Here are my references. Thank you for watching.